Anxiety is another problem that is psychological, found in the patients who undergo palliative care. What is anxiety? Anxiety is when you worry very much about a particular thing. It is called as anxiety. And anxiety is a normal and an universal emotion to all the human beings. Right? When something does not occur, or when something goes out of track, or when something does not meet our expectations, we are anxious, which is a normal reaction to the things that are happening around us, and it is an universal emotion. It occurs frequently in patients with physical disease. It also occurs among the patients who have some chronic disease condition. It includes a continuous clinical spectrum ranging from normal to psychiatric. So, anxiety, when it is within a limit, it is normal. When it is out of limit, then it is called as psychiatric. It becomes abnormal or maladaptive. And the abnormal anxiety is distinguished from normal anxiety by the following steps. When the anxiety is out of proportion to the stress, there may be crisis, there may be stress, and we respond to that stress or crisis in the form of anxiety. But when the response is more, when the response is abnormal to the crisis that had occurred, say for example, you lost a pen or you have got low marks in your exam. So the response to the loss of pen or the less marks in the exam should be within the normal range. If it is abnormal, if you're going to keep on be worrying about that particular thing, then it is out of proportion. Similarly, here, people who have terminally ill conditions or terminally ill diseases, when they experience anxiety, and if this anxiety is out of proportion to the stress, then it is said to be maladaptive. Persistence of symptoms for more than 2 weeks, if they are in this state, if they are anxious all the time for more than 2 weeks, then it is found to be abnormal. Severe physical symptoms or recurrent panic attacks. So, if they are going to experience physical symptoms because of their anxiety, or if they are going to get recurrent means repeated panic attacks. Panic attack is they get scared, frightened, fear, right, of that particular crisis, then it is said to be abnormal. Or if there is disruption in the normal functioning, if they are unable to do their normal work, they are unable to go to their work or concentrate in their work, or when they are not able to do their daily household routine, then it is found to be abnormal. Let us now see the clinical spectrum of anxiety. Here we have various conditions. The first one is the normal anxiety. This occurs in response to stress and crisis associated with the disease. So, the stress, the crisis that occurs because of the physical disability or the physical disease, then we call it as the normal anxiety. It is more frequent in the terminal phases of the disease. So it occurs usually at the end stage of the disease. The second one is the reactive anxiety, adjustment disorder with anxious mood. It is called as the adjustment disorder with anxious mood. It lasts longer than expected. The patients are anxious throughout the day for more than 2 weeks. And if it exceeds the level that is regarded as normal and adaptive, so when they overreact to the particular crisis, then it is considered to be abnormal. And if it follows a defined incident or stress, so when that anxiety behavior occurs because of a particular incident or of a particular stress, then it is called as the reactive anxiety. In reactive anxiety, the depressive symptoms frequently coexist. So they have anxiety, at the same time, they also have depression. So they coexist in the reactive anxiety. The next type is called as the generalized anxiety disorder, which is characterized by chronic, unrealistic worries, with autonomic hyperactivity, apprehensions, and hypervigilance. So they have unrealistic worries. They worry too much. They imagine several things which may not even happen. So that is being unrealistic, right? They worry about several things, and it is associated with autonomic hyperactivity. So just walking here and there, or tapping their feet. So autonomic hyperactivity may be there. And apprehensions. So apprehensions is, they may think, if that happens, if this happens, what would become, what would happen to my family, or what would happen to my children, right? Such things. And they are hypervigilance. Hypervigilance is trying to be alert all the time. And the anxiety is more pervasive. Pervasive is which is there persistently, or for a period of time it exists, occurring in many different situations, right? So in different situations, if they experience that anxiety, so that could be a disorder. Patients have more severe and disabling symptoms which appear inappropriate or out of proportion to the medical situation. So here the patients, they have some symptoms, and these symptoms are disabling, and those symptoms are inappropriate, or they are not associated frequently with the illness or the disease. So out of proportion, if the anxiety that the patient experience is out of proportion or disproportionate with that of the disease, then that can be categorized as the generalized anxiety disorder. The next in this group is called as the panic disorder. Panic is bayam. Repeated, sudden, unpredictable attacks of intense fear and physical discomfort. So when they repeatedly and suddenly have an unpredictable is all on a sudden. They have an attack of intense fear. So they are fearful of something suddenly, and that fear is very intense, and that causes physical discomfort to the patient. Then it is called as a panic disorder. Attack follows a crescendo pattern. Crescendo means it takes, uh, it goes to a peak. So their fearfulness, their panic is extreme, reaching a maximum in a few minutes, and it may occur in many different situations. So when they are fearful about something, and if they are extremely fearful, which goes very to a greater height, then we call it as a panic disorder. Next is the phobic anxiety. Anxiety provoked by exposure to a specific feared object or situation. So here they react to a object, or they react to a situation where they become very anxious. Like when somebody goes for a diagnostic procedure, and if they don't want to take a MRI scan, say for example, or a CT scan, say for example, they don't like to be alone. They have to be pushed into the machine to get the scan. So if they have that fear, and if we insist that that particular procedure has to be done for further treatment, then as soon as they see that machine, as soon as they see that scanning machine, they panic. They are extremely fearful. So that is called as phobia, and usually it results in an avoidance response. So here what they do, they will say that they don't want to undertake that procedure. They will not perform that procedure because they don't like it. It is not because they don't like it, but because they fear that. So that is called as the phobic anxiety. Next is the organic anxiety syndromes. Organic anxiety syndromes may be, which are general kind of things, like uncontrolled pain. They think that they have uncontrolled pain. Hypoxia. Hypoxia is all of a sudden they have breathing difficulty, lack of oxygen. Hypoxia is actually lack of oxygen, and leading to respiratory distress. And hypoglycemia, sudden reduction in the blood glucose level. Any uncontrolled or severe physical symptoms. So some uncontrolled pain or physical symptoms can also occur. So this is called as the organic anxiety syndromes. And also acute confusion, right? They are very much confused, or delirium can occur in the patient. So delirium is when they become insane. They don't know what is happening, how they are reacting, how they are behaving. Organic anxiety syndromes can also occur as a result of drugs that are given for the patients, like the corticosteroids, metoclopramide, bronchodilators, or it can also occur due to drug withdrawal. Drug withdrawal is already drugs are being given to the patient for some treatment, and if those drugs are stopped all on a sudden, then it is called as the drug withdrawal. Like when they had been in the opioids, barbiturates, benzodiazepines, and alcohol or nicotine. So this alcohol withdrawal can also cause such problems, or tobacco withdrawal also can cause such problems along with the drug withdrawal. Treatment for anxiety disorder: treat the cause of the organic anxiety syndrome if present. So you should first identify what is the cause of their anxiety and remove that cause. And if that cause is removed, then the patient can be relieved from this particular disorder. Exclude adverse effects of drug and drug interaction. If some drugs are causing such reactions, the drugs has to be removed in the treatment. Treat other factors that may cause or aggravate anxiety. So if pain or any physical symptom or some social issue or cultural problems or spiritual issues are causing anxiety in the individual, then such problems have to be solved, or such problems have to be alleviated for such patients. Treat depression if it is present. So I told you anxiety can occur along with depression. So if depression is there, then depression has to be treated with appropriate treatment. General support mechanism has to be given. This we have also discussed in the depression. What is the general support mechanism? The support by the caregivers, by the family, by the society, and brief supportive psychotherapy. So giving them short periods of counseling, group therapy. So this can also be helpful for such patients. And psychological behavioral therapies can also be given for patients to overcome their anxiety. Relaxation trainings. So this is very important. So you can make the patients relax by reading or by listening to music or watching some TV shows or going out, sitting in a park. So these are all certain relaxation techniques. Meditation is the best relaxation technique. Hypnosis is um, making the person unaware of the surrounding and probing into the problem that has actually caused their anxiety. Cognitive behavioral therapy and biofeedback. Biofeedback is reacting to physical problems by using sensors. Distraction therapies. So, distracting the patient from their stress or from their crisis, from their pain, and music therapy, art therapy, socialization, all would be helpful for such patients. And apart from this, drug therapy also can be given, like anxiolytics, hypnotics, antidepressants, and neuroleptics. This is a short segment on anxiety. We saw what anxiety was, the clinical spectrum of anxiety, the different types of anxiety, and also the treatments that are possible in overcoming anxiety for the patients who are given palliative care. Thank you.